Millions of Medicare beneficiaries are about to find one of the most important pieces of mail of the year in their mailbox, the Annual Notice of Change, or ANOC. It may not look exciting at first glance, but this letter could determine how much you pay for coverage, whether you keep your doctor, and even if you stay in the same plan for the coming year. For 2026, experts say the changes inside could be bigger than usual, and there's an important deadline to keep in mind: September 30. If you set this letter aside or miss the date, you might be locked into higher costs or lose benefits you rely on. Here's what's happening. Anyone enrolled in a Medicare Advantage plan or a Part D prescription drug plan will receive this notice in September. It explains how your plan is changing for the new year. Everything from premiums and deductibles to which doctors, hospitals, and pharmacies are in your network. For 2026, rising healthcare costs and insurer cutbacks mean more plans may raise premiums, trim benefits, or even close down completely. That means some people could see higher drug copays, fewer covered prescriptions, or limits on extras like dental, vision, and over-the-counter allowances. This isn't just a routine update. Because of new rules coming in 2026, like the government starting to negotiate prices for certain prescription drugs, insurers are adjusting their budgets. While those drug negotiations are good news long-term, companies may try to balance savings by changing other costs or coverage. And remember, these programs are run by private insurers, so they make changes based on their own bottom line. United Healthcare and other companies have already announced they're dropping some plans entirely next year. If you don't read your letter, you might not know your plan is disappearing until January. So what should you do when this letter arrives? First, don't ignore it. Expect it in your mailbox by September 30 and open it as soon as you get it. The first few pages will give you a summary of the most important changes. Look at your premium and deductible. Check if your doctors and specialists are still in the network, and make sure the prescriptions you take are still covered at an affordable price. Also think about your own situation. Have you moved, started traveling more, or developed new health needs this year? These changes can affect which plan fits you best. After reviewing the letter, get ready for open enrollment, which runs from October 15 to December 7. Starting October 1st, you can see all the details of 2026 plans and compare them. Don't wait until the last week, because call centers get busy, and some plan spots can fill quickly. If your letter says your current plan is ending, save that document. It gives you a special right to sign up for certain other coverage, like a Medigap policy, without having to answer health questions, even if you have pre-existing conditions. A few more tips can help you save money in 2026. Many Part D drug plans will include a deductible, which can be as high as $615, so be prepared for higher upfront pharmacy costs. Look carefully at which pharmacies are considered preferred in your plan. They often have the lowest copays, and keep an eye on extra benefits in Medicare Advantage plans. Dental, vision, and hearing perks are popular, but many insurers are trimming these extras. If your income is limited, check programs like QMB or your state's Medicaid help, which can pay for your Part B premium or other costs. Even though the Annual Notice of Change isn't flashy, it's a roadmap for protecting your health and your wallet in the year ahead. By opening it, reviewing the changes, and planning ahead, you'll have time to switch plans or adjust your coverage before it's too late. So when your letter arrives, what will you look at first? Your doctor list, your drug coverage, or your premiums? Let me know in the comments below. And don't forget to subscribe, hit the like button, and share this video with friends or family who have Medicare. Staying informed today can save you hundreds or even thousands of dollars tomorrow.